Hello everyone, welcome to another video. So in today's video we'll be looking at a brand new topic known as thalassemia. So what is thalassemia? Thalassemia is a group of inherited blood disorders where the body makes less hemoglobin than normal. So this hemoglobin is actually the protein in the red blood cells that carries oxygen around the body. And when there's not enough hemoglobin, the red blood cells become small, they become fragile, and they are easily destroyed, leading to anemia, which is low red blood cell count. So thalassemia is more common in people of the African, Mediterranean, Mid-Eastern, South Asian, and Southeast Asian descent. So, to understand thalassemia, because thalassemia is different from sickle cell anemia. So, to understand this thalassemia, we have to look at the normal red blood cells. So, basically, the hemoglobin is made up of two kinds of protein chains, the alpha globin and the beta globin. So these chains, they combine in balanced amounts to form the healthy hemoglobin. So in cases of thalassemia, there is a mutation in the genes responsible for making the alpha or the beta chains. So basically there's a mutation in the gene that is responsible for making the two proteins that is found in the hemoglobin. So depending on which chain is affected, the condition is called either alpha thalassemia or beta thalassemia, and the imbalance causes defective hemoglobin, leading to poor oxygen transport, destruction of red blood cells, and compensatory overproduction by the bone marrow. So basically, because there's an imbalance in these two proteins, it causes defects in the hemoglobin, because these two proteins have to be balanced to have like a healthy hemoglobin. So for the pathophysiology, in alpha thalassemia there's a defect in producing alpha globin chains, and in beta thalassemia there's a defect in producing beta globin chains. Do you see what I'm doing there? So the severity depends on how many of the affected genes are inherited from the parents. And in cases where the person has severe thalassemia, the bone marrow tries to compensate by producing more red blood cells, but these cells are often ineffective. And the continuous breakdown of abnormal cells leads to enlargement of the spleen, bone deformities, especially in the face and skull, iron overload due to frequent transfusions or increased absorption. So what exactly causes thalassemia? So it's basically inherited genetic mutation in the globin gene. So it is passed from parents to children. So a child must inherit the defective gene from both parents to have a severe thalassemia. So looking at the types of thalassemia, I mentioned there's alpha thalassemia and beta thalassemia. So in cases of when someone has alpha thalassemia, so it's mild to severe based on how many alpha genes are defective. So based on how many alpha genes are defective, so there are 4 alpha genes. So if all these 4 genes are affected, it usually causes stillbirth. So for beta thalassemia, it includes beta thalassemia major, which is the most severe form, beta thalassemia intermedia, which is the moderate, and then beta thalassemia traits, which is a mild carrier. So beta thalassemia major is also called Cooley's anemia, and it often requires lifelong blood transfusions. So looking at the symptoms, symptoms vary by type and severity, and it may include fatigue and weakness, pale or yellowish skin due to anemia or jaundice, enlarged spleen or liver, slow growth and delayed puberty in children, bone deformities, especially in the face, the skull, and then the presence of dark urine, increased risk of infections, and in severe cases, symptoms appear within the first 2 years of a child's life. So, conditions that could mimic the same symptoms we see in thalassemia, for example, sickle cell anemia, iron deficiency anemia, autoimmune hemolytic anemia. So basically, certain kinds of anemias, because this is a blood disorder. Then also lead poisoning, and there's something called hereditary spherocytosis. So all these conditions, they have similar symptoms that we see in thalassemia. So for the diagnosis of thalassemia, so the doctor will check for the patient's complete blood count, which will show microcytic or hypochromic anemia, and in these cases it shows like pale red blood cells or small red blood cells. Then peripheral blood smear, which shows target cells, nucleated red cells. Then hemoglobin electrophoresis, which identifies abnormal hemoglobin types, especially useful in beta thalassemia. Then genetic testing to confirm the type and the inheritance. Then iron studies to rule out the if it is iron deficiency anemia. So prenatal diagnosis can be done through chorionic villus sampling or amniocentesis. So this can be done before the baby is delivered. So for the treatment depends on the type and severity. For mild thalassemia, whereby which is also known as beta thalassemia traits, so it usually requires no treatment, and it's important to avoid unnecessary iron supplements unless iron deficiency has been confirmed by the doctor. So that is one significant thing when treating this mild thalassemia. So when it comes to moderate to severe thalassemia, the patient will require regular blood transfusions every 2 to 4 weeks. Then iron chelation therapy to prevent iron overload from transfusions, using medicines like deferoxamine or deferasirox. So folic acid supplements too are given to support the red blood cell production. Then bone marrow or stem cell transplant, which is the potential cure in some children. Then surgical removal of the spleen if the spleen becomes enlarged and overactive. So for the management of this condition, long-term care includes regular monitoring of blood counts, iron levels, and organ function. Then iron chelation to prevent damage to the heart, liver, and endocrine glands. Then growth and developmental assessments in children, and also vaccination and infection prevention, especially if the spleen is removed. Then also trying to give advice like genetic counseling for the affected families, like for them to know what exactly happened to their child or is happening to their child, so they would know about the condition. So it's good to educate patients on the proper medication use when they are treating this condition, especially for iron chelation. And then we have to counsel patients that have mild thalassemia. We have to counsel them on the importance of avoiding iron supplements unless they are needed. And so we have to advise for proper adherence to folic acids and all the the other treatments that are given that is needed for the condition. So in summary, thalassemia is a genetic disorder of the hemoglobin production, and it leads to chronic anemia and complications due to ineffective red blood cells, and it is classified into alpha thalassemia and beta thalassemia depending on the gene involved. So treatment ranges from no intervention in mild cases and lifelong blood transfusions and iron chelation in severe cases. So early diagnosis and proper management are key to improving the quality of life of this individual and preventing complications in people with the severe forms of this condition. So thank you for watching this video, and I'll see you in the next video. Bye.